could we just introduce ourselves in the chat? Although we would have other aspects of introduction during this, the beginning of discussion, please do share your name and maybe a little bit about your organization and where and unlike other webinars or most conversations that we have, this is one where we will have everyone open to discussion, but let's try and keep on mute if we have background communication. Otherwise, we'll try our level best to try and mute some people as much as we can, but we need to have this as an open conversation. So Alexa and everyone else that is supporting this conversation, we're 3 minutes in and we'll begin so that we can save on time. And also, since we're recording this, we can always have these conversations shared for anyone that comes later. So once again, good morning, good afternoon. I hope not. Welcome to our first series of the Localization Conversations. It's a series hosted by the GNC Anti-Racism and Localization Working Group. And in this first session, we really want to know what challenges are local and national actors facing. And it's not only challenges, as much as we're saying challenges, we also want to be able to engage and ask, what are the opportunities that you are actually having during this time? So it's challenges and opportunities. We'll hope you'll be able to share all that with us. To begin with, like I've mentioned, we have 3 series, and Alexa will help us. We'll share a little bit more on the other series. Before we go ahead, I'd like to introduce myself. My name is Martha Nakakandi. I am the program advisor for CMAM and Wasting within the Global Nutrition Clusters Operations team, and also the co-host of the Anti-Racism and Localization Working Group. I am hosted by IMC, and I'll also give Alexa to introduce herself as we're co-facilitating these conversations together. Over to you, Alexa.
Thanks, Martha, and good morning, good afternoon, everyone. Really excited to have this call today, and it's great to see so many colleagues on the call. My name is Alexa, or Alexandra Humphreys. I wear 2 hats for the GNC, but one of them is Localization Help Desk, so I get to work on everything related to supporting local and national actors. I also am helping the GNC with strategy development, so two different hats, actually. But I also have the honor of co-chairing the Anti-Racism and Localization Working Group with Martha. We've been supporting that group for a number of years, and it's been great. I am based in Lisbon, Portugal, and thanks for being here. Back over to you, Martha.
Thanks, and always for everything. We do have some super people behind in the background, Mary, Miriam, and the rest of the webinars planning team. Thank you very much. So we're very glad, and we thank you all for contributing for your important conversations once we have them. The objectives of this series is to explore the challenges, opportunities, strategies, and vision of the local and national actors, and this includes even government, amid this changing nutrition and emergencies landscape. It's going to be 3 sessions with different options for timing, the morning time and then the evening time, depending on the different time zones people are in. We may not be able to cater for every time zone, but we've tried our level best. During today's session, which is really focusing on challenges and opportunities that local and national actors are currently facing, it is an idea that the GNC as a collective is being called upon to listen and to take on the insights that we'll be hearing from all of you today and all throughout the series. The GNC collective here includes everyone working in nutrition in emergencies at all levels, including the local national actors, international actors, governments and authorities, academia, donors, and others who engage with the GNC. To you, all the representatives of the local and national actors in the space here with us today, we value your perspective and experiences in how your organizations or your agencies are experiencing the times or within the current changes. Please, everyone, do share your name, as I've mentioned, an organization in the chat. And also for those in LNAs, we encourage you so much to share a little bit about your organization in the chat if you can. With that, I think I'll hand over to Alexa. So even as part of sharing with us, please, if you have a web page, you can include that. If you have Facebook, you can include that in the chat. And we're trying to have as much space to share and to learn about you as local and national actors. I think with that, I'll hand over to you, Alexa, to take us through how the session will be.
Thanks, Martha. Colleagues, just a quick overview. I know Martha had already mentioned this series includes these 3 different sessions. We do offer them at 2 different times. This is our very first call of the series, so it's a session 1, the earlier call. We encourage you to attend as many additional calls as you would like. There are always opportunities to learn and share. If they're the same topic for the 2 different times, so if you want to attend just one of those, that's fine. If you'd like to attend both, that's also very welcome. So just to say, this is our very first call in this series of 6 calls for 3 sessions. And then we don't have a sort of a strict agenda for the day. What we have is more of a session flow. So to give everyone a sense, and maybe even before I get into the session flow, I also want to acknowledge that unfortunately the series, we're only offering it in English due to budgetary constraints. We do acknowledge that is a severe limitation. There's so many more colleagues that we wish we could be including in these calls and facilitating in various languages so we can include them. But I did want to acknowledge the call is just in English today. But in terms of the session flow, we're going to have a series of interactive polls. These polls are to learn about you, the folks that are on the call. Some of the polls are for everyone. Some we're just asking for local and national actors. We really want to hear about specifically their experiences, your experiences. We're going to pause and open the floor for discussion at many different points because we want to make sure that this is a very much a space for dialogue. Don't hesitate to turn on your mic if you'd like to speak, and feel free to jump in. Raise your hand if you're comfortable with that, or just jump in. And as always, as we're going through, you can also share any thoughts and insights you have in the chat. So we just make sure we don't miss that. And then we're not here acting as any sort of a Q&A session for the Global Nutrition Cluster. We're really here to support this dialogue. So if there are any questions, we're probably going to redirect them to everyone on the call and hear what others have to say. Or if there's specific questions for the GNC, we'd probably direct you to the website and the request form if there's nutrition and emergencies technical questions. We can always follow up on those. Okay. Martha, back over to you to get started with our first polls.
Yes, I know I've already mentioned that you should indicate in the chat, but we now have a quick poll to see the different organizations that we have here, and there's so many varied definitions, but within the GNC collective, we tend to take the ISA definitions, and so we want to know how many are in government, how many of you are from local and national organizations, and within these we also have CSOs, grassroots organizations, women-led organizations. So we've put all of them in here. How many of you are from NGOs, the UN agencies, those from the donor space, and anyone else that has not been included? Please go to your Menti, and the code is already here, which is 81871338. So far, all those that have gone into Menti are all from NGOs. And if anyone is for any reason not able to join Menti, you can also tell us in the chat. UN agencies now are 33%. Please do all try to vote so that we have a better view of who is joining us for these discussions. Okay, from the donors, that's interesting. Great to have you join us too. I'm still hoping to see a pop-up from the LNAs. Yay, there we go. Great. %11 from the LNA space. Alexa, how much more time do we give to each of these polls? We're 80 people in this conversation.
Gosh, maybe we give a little bit more time because it looks on the bottom right hand, we can see just 14 people have filled out the Menti. Yeah, if we can get some more people filling out the poll, that would be fantastic. 15. Also, though, some folks are just writing in the chat. They're kind of their organization type. So that's a consideration too.
Okay, yeah, we do have we do have a couple of them here from quite a number of LNAs actually in the chat box. We have Hassan, we have Habib, we have Dr. Ahmad from Audu. So I want to believe that the graphic presentation here does not necessarily represent everyone that's joined the call. Okay, now that we know that we do have people from varied entities or agencies, could we go on, Alexa?
الو صباح الخير.
صباح الفل، ازيك؟
صباح الخير.
الحمد
ولا
لله.
رحتش؟
كيفي؟
لا انا تاني واكل النهارده.
طيب very good.
We may have to
شفت الايميل
mute.
اللي منير بعتها؟
We may have to mute Nagla briefly. Thank you. Alex, I think we can move on now to at least having an idea of where we're coming from in the regions. Okay, so where is everyone joining us from today? We would like to know in terms of the regional representations. You're also free to indicate in the chat the specific countries. I see a lot of people from various countries: Bangladesh, Somalia, Pakistan. Okay. Localization conversation. We also have Chad. I see we have quite a lot of people from the South Asia, the Middle East, and the West and Central Africa group is also coming up. South Asia is quite the biggest in addition to other right now. We do have a lot of people coming in from Afghanistan. And Palestine, Syria. And we do have a couple of people that are global. We have Yemen. Nigeria. And for those who are just joining us, please do put your name and organization in the chat. And if you're from a local organization or a local national organization, please do indicate in the chat your website or your Facebook page or any additional information to help us get a better appreciation of who you are and the work you're doing for the communities you serve. Alex, I think we'll move on to the next. The largest group is coming from South Asia. I'm sure the rest of the other groups will also have space in the late afternoon calls. So thank you very much. So over to you, Alexa.
Yeah, thanks, Martha. Colleagues, so our third poll of the day, we're doing something a little different here. This poll is only going to be for local and national actors to fill out. So if we can have, this is just national or subnational government or authorities, and then different kinds of in-country organizations. So NGOs, CSOs, any sort of homegrown organization working in a humanitarian setting. So we would invite all of the local and national actors to complete this poll. If possible, I acknowledge that some are having a bit of challenges with the Menti poll, and that's fine too. If possible, try to get into the Menti poll because it's really useful and interesting for us. If not, you can put in the chat. And then, so this poll is just asking about, there have been a lot of changes in the humanitarian sector in recent months. So we would just love to know, has your organization or agency been affected by this? And the options are selecting, yes, we have been affected. No, our organization or agency has not been affected. Or if you're unsure, it's a bit uncertain, you can also select unsure. Okay, great. We've had about 6 colleagues, 7 colleagues.
Good morning, Alex. Sorry, should UN at the country office also answer this?
No.
Oh.
Yeah, only local or national actors. Thanks for asking and thanks for the clarification. So organizations that are headquartered in and from the country they're supporting.
We do, Alexa, we do have a couple of yeses in the chat too. Yeah.
Great. Yeah, that's true. We do have some yeses in the chat. So we have to mentally add that to what we're seeing on the screen. So far, 12 of local or representatives from local or national organizations or agencies have voted. So far, we're seeing 75% yes, affected, and then I see 2 more yeses in the chat. And then we have 17% no, not affected by the recent changes, and then 8% unsure. Maybe give it just a minute more if others want to respond in the Menti or in the chat.
There's a couple of yeses in the chat that are coming up.
Yeah, I think there's one no in the chat and otherwise yeses. Okay.
Someone is asking for the link to the Menti. Let me try and share that.
Yeah. Yeah, colleagues, anyone that's struggling with the Menti, just go to menti.com and there's a code at the top of the screen. Hopefully you can see it. Okay. So this is starting to paint a picture for us. It does seem like what we're seeing in the chat combined with the graph is leaning towards more local and national actor organizations or agencies have been affected by recent changes. Some have not, and then there's some uncertainty as well. There's a number that unsure how these have affected their organization, which is fair. Now we're getting into a different kind of Menti poll. This is going to be also only for local and national actors, so only for sort of homegrown organizations or government entities that are headquartered in and operating within humanitarian settings. So for local and national actors only, we'd love to know, the last poll was about, have you been affected? Now we'd love to hear, this is where we get into the really, good discussion piece, but we'd love to hear from you how your organization has been affected. We're happy to hear challenges. We're also happy to hear opportunities, but we'd love to get a sense from your perspective how your organization or agency has been affected. So this is also going into menti.com. We'll give a little more time. Okay, we got to know so much. So we'd love to hear, it takes a little bit more time to actually sort of write out some of your responses, but we would love to hear, so the how has your organization been affected? So feel free to put this in the Menti. If there's any challenges with Menti, you could put it in the chat as well. And this is also the part of the call where we are going to feel free to write your responses in the Menti or in the chat. But we are also going to welcome our colleagues in, anyone who would like to turn on their mic and come in and talk to us about how your organization has been affected. Really happy to hear from you. UNRWA in Gaza, significant operational challenges, movement restrictions. Yeah, I see some more folks in the chat saying that their organizations have been really affected. Colleagues, would anyone like to come in and tell us a little bit more about how your organization has been affected? No life-saving intervention stopped. Sana, I see your hand is up. Would you like to come in, please?
Yes, thank you so much. I'm going to talk about UNRWA. Really, UNRWA has been affected so much. First, 2/3 of the facilities of UNRWA in Gaza have been destructed or destroyed, and 100% of them are affected. The staff members of UNRWA also have been killed during this emergency. The services, the supplies, the stores, the restrictions over the borders, the restriction over the political restriction over UNRWA, the funding, all of these issues. Just wanted to give this comment on brief. Thank you.
Yeah, Sana, thank you for sharing. I can't even imagine the difficulties you're facing in operating there. Yeah. Other colleagues like to come in and share? Haya, please come in.
Thank you very much. Actually, I want to continue with Dr. Sana. Also, I'm joining from UNRWA because I've noticed that so many colleagues are coming from different countries. As UNRWA is serving Palestinian refugees, around 6 million Palestinian refugees located in West Bank, Gaza, Lebanon, Syria, and Jordan. So some of these fields have critical challenges. Yani if in continuation what mentioned by Dr. Sana and Gaza, also West Bank is a very conflict and hot area. يعني UNRWA is, let's say, have operational challenges, including movement restriction, ongoing conflict, damage in healthcare infrastructure, closing in some area. Also, the limitation in humanitarian access, which is affecting our ability to deliver the health and the nutrition services and medicines or food items, for example, also. So in other fields, such as Syria, Lebanon, and Jordan, maybe we can mention in general, we can mention the struggles we have in economic instabilities, overcrowding, or let's say stability in funding, for example. So in regarding this, in general, this is what I can mention. Thank you.
And
Thank you
Alexa,
so
there's
much.
also comments coming in from the chat.
Great. Maybe we'll keep going with the hands, and then if anyone in the chat wants to come in as well. Rania? Would Rania like to come in?
Yes, good morning, everyone. This is Rania Abu from Jazur for Health and Social Development, located in the West Bank and Gaza. Actually, Jazur, as an organization that works in humanitarian settings, we have never been a direct service provider before the war, but since the starting of this genocide, actually in Gaza, we have shifted our aspect and concept, and we have started doing direct service providing to beneficiaries, serving all ages, let's say. But the challenge is that we have lost many of our team in Gaza. We have restrictions on movement, as you know. Even the fuel we couldn't provide fuel to our team so they can go from one place to another to serve people. They had to walk on their foot. And also the restrictions of the supplies entry to Gaza to serve all those people. Sometimes we do the nutrition screening, we do everything, but we don't have the supplies to provide to the children or the mothers. And also the let's say the vulnerable categories were not all taken into consideration. The focus was more on children and mothers breastfeeding, pregnant breastfeeding, but elderly are also vulnerable. Let's say also people with disability are most vulnerable. So we had to, let's say, unfortunately, we had to prioritize the categories, which is not fair in my opinion. Thank you.
Yeah, thank you for sharing that. Hana, I think if that's not an old hand, do you want to come in as well?
Yes, thank you so much, and thank you for providing us with this platform to engage and discuss. So I'm actually Palestinian from Jerusalem, but I'm now speaking as the country director of Terrorism in Afghanistan. So I think everyone has felt the impact of the US funding suspension or termination, but also there are some key donors, European donors, that have also reduced their funding. And as Rania was saying, their last point, this has affected the whole humanitarian community in the sense that while the funding is decreasing, people in need are increasing. So we had to prioritize, to rearrange our priority categories. And this also had created pressure on available services. For example, we are providing health services to basic health centers and protection in child-friendly spaces. So the catchment area is now increasing because other service providers who are complementing our services have lost their funding, and this creates more and more pressure and expectations from the community. Another challenge we are facing also is the shrinking humanitarian space with the intrusion of the authorities sorry, in our procedures and systems. And of course, everyone knows the situation of Afghan women here. And with the recent as well challenges, the expected new influx of forced returnees, refugees from Pakistan and Afghanistan. So this is Afghanistan is defined as a protection crisis. And now with the funding decline, and we are humanitarians, but we're always responding to political decisions. So that's a crisis that is getting more acute. Thank you.
Thank you so much for adding that, for sharing. Just seeing some more, lots of great comments in the chat and also on the screen. Would any other colleagues like to come and speak and share? Yeah, also looking at the chat, just highlighting some things that are being shared there. Definitely political climates have been mentioned. Also climate change has been mentioned by a couple colleagues. In Afghanistan, mention of drought and harsh winter and its effects on the affected population. In the Menti, mention of having staff cuts, about gender-based restrictions for NGO workers, and definitely issues with access and limited funding. Yeah, would anyone else like to turn on their microphone and share a bit more?
Hello, good morning.
Oh, hi, Grace, please come in.
Hello, good
Or
morning.
maybe
Can you hear me?
Hassan. Hi, Hassan,
Yeah,
welcome.
Hassan. Thank you very much. Hassan Mohammed from Nigeria. Hello, can you hear me?
Yeah, you're a little quiet, but we could hear you.
Can you hear me now?
Yes, you sound good. Yes.
Yeah, okay. From our own side, I'm working with HRC, one of the local NGOs here in the country. One of our major challenges we've been facing is the accessibility due to security reasons, and accessibility due to the geographical location of our beneficiaries who are residing in an areas that we find it very difficult for us to access them because of the settlement where they are. And another thing is the limited funding because of the what is happening globally. So we've been having these challenges of difficult funding, and it affected us a lot. So a lot of beneficiaries we could not serve them because of the limited funding we are experiencing right now. And we have to limit some of the services. In other places, we just have to concentrate where we can get the accessibility to those places. Thank you very much.
Thank you for sharing. Yeah, it seems like accessibility, we keep seeing this come up today as well. Huge challenges. Let's see, who do we have here? Abdullahi, please come in.
Thank you so much for this meeting, for the well coordination. I'm Abdullahi from Adro, Somalia. as every one of you understand the situation in Somalia, Somalia remains an unstable country with poor governance and lack of representation without, national domestic produces. It faces a lot of challenges, including economic challenges. With this, there's a lot of insecurity and clan conflicts that is rising due to the weak governances. There's crisis in terms of drought, this continuous drought. Somalia faces a continued drought. Maybe it takes like 3 to 4, 5 years seasons without rain. And then when it rains, there's a lot of challenges of floods that destroys all crops and maybe livestock. There's also poor infrastructure. The country faces a lot of challenges in terms of roads, road network. There's problems of health crisis, the problems of education crisis. There's also political fragmentation between the federal government and the regional member states. All this now creates to food insecurity, which gives now a major problem to the country. With that in mind, there's also the harsh funding cuts from Trump that has rendered the country backward. And there are a lot of challenges now in terms of humanitarian services, where all organizations are now feeling the gap, really. Thank you so much.
Yeah, thank you so much for sharing, Abdullahi. Yeah, others are very welcome to come in as well. Okay. Maybe considering time, we'll move. We have one more. Grace, please come in.
Yes, thank you very much. I just wanted to add on what my brother Ayazit Abdullahi has said about Somalia, because I work in Somalia. Of course, we are seeing a lot of continued conflicts because communities have to share very scarce resources. They are being displaced because of the drought, and we are experiencing more families in the IDP camps with no services or basic services at all. Children are not accessing education. There is no water supply. There is no wash facilities. And in some areas, the situation is really critical. It's severe. And the aid cuts from USAID has even increased the suffering of these communities who are already going through very hard times. We went into one of the camps and we realized the families had no water, no light, no wash, no latrines at all, and they didn't have this access, and there was escalated GBV cases because of there's no proper lighting, there's no proper structures. And also when we look at the local partners, the staff have lost their jobs. They have no, there are job cuts because their funding has been cut. So some of these are things, scenarios which we are coming across in Somalia due to the effects of the aid cut and also the climate change effects. Thank you.
Yeah, thank you for sharing, Grace, and more from Somalia. Great, colleagues. So we're going to move on to one more poll, and we'll also, following that poll, be very open for dialogue. But over to you, Martha, for the next one.
Maybe Alexa, before we go to the next one, I know you've already moved, but I'm wondering if there's a silver lining or if there have been some opportunities I know it's a challenging time, but are there some opportunities, or has there been a silver lining? Has there been a change in the way we work or in the way we do our business, which is not now any more business usual, but business unusual, that we can learn from, that we can appreciate? Anyone can share in the chat or even just unmute and tell us.
So maybe I can come in.
Yes,
Well,
Hannah.
there was a glimpse of a silver lining at the beginning, especially U.S. Funding termination. So NGOs were looking into, for example, the available funding opportunities, going there, consortiums, being partners rather than competitors. So that seemed to be a silver lining, but it soon disappeared, unfortunately. So it turned into extremely high competition now for funding. But also, on the other hand, we are looking at becoming more cost effective, more efficient, and perhaps also there's a movement towards localization that also supports resilience and sustainability, and then that also, in a way, mitigates the impact of the funding cuts. Thanks.
Hey, thank you, Rana. Because I mean, we're all here, we're still soldiering on. There is something that we're doing, and thank you so much. Please continue sharing some of your challenges, some of your opportunities. It could even be your ways of working as LNAs, your ways of engaging with every other, partners or agencies within the NI space. We would really appreciate some of those. Yes, Alexa, let's go to the next poll. Okay. This falls very, very well into what I just said. I probably spoke a little bit earlier. So we would like to know how your organization or agency or ministry department within the government has actively adapted, or how you are innovating or responding to these changes. I know Rana has talked about trying to be cost efficient. So please do share with us how your organization or agency is adapting or innovating or responding to the changes. And also feel free to unmute and share with us. Yes, Sana.
Yes, thank you. Let me talk about UNRWA in Gaza. For example, during the war situation, when most of the facilities have been destructed and people have been displaced from area to area, so UNRWA have some adaptations or response to the needs of those population, like having medical points in order to provide those services within the shelters where those displaced people have been residencing, and also to the around the displaced people gatherings in those areas, either through formal medical points or informal medical points, so that they can continue providing health services to those being displaced. Also, there are many places have been rented and modified and restructured in order to provide the services, in addition to modifying the policy and modifying the response plans due to emergency to be adapted according to the current situation, adapting the technical instructions, the guidelines, being most cost effective. So actually, it's being creative and innovative within the response of UNRWA to the population and to the refugees and non-refugees as well after the war, and having other ideas and other adaptations to meet the changes on the ground and to respond to the needs of those population, and in order to ensure the continuity of services and support, either health services or nutrition services or other services, to meet those needs and support this population. This is like a glimpse of somehow adaptations that have been made after the war. There are many things, but this is in brief. Thank you.
Thank you. Grace, over to you.
Yes, in Somalia, we have a program on localization. I'm going to talk about localization and capacity and adaptation and innovation. So through this program that is funded by GFA4, we have a program on a capacity strengthening for the local organizations, partners. That has been going on for 3 years, and now we are on the 4th year. It has built capacities for 5 local organizations, and now we are on the 4th year that we are operationalizing the capacities that have been developed. And this has seen now local organizations reviewing their policies for efficiency, and also ensuring the practice, walking the talk, not only just reviewing policies, but ensuring that we review our policies, internal policies, and we implement the policies that we have reviewed. And now we are also doing peer mentoring for other 15 local partners to extend and mentor them on the capacities that have been strengthened. And on these capacities, we are looking at a climatic change, innovation approaches, and people-centered approaches that can strengthen the communities on humanitarian preparedness and climatic change designs, that we can design our interventions with a focus of the climatic changes and the effects, and doing assessments. So this is one of the approaches. When it comes to innovation, we have applied like cash transfers for efficiency and using the technology that we have so that we can have timely interventions during the disasters. So these are some of the approaches we are using in Somalia. Thank you.
Thank you, Grace. I can see we're having a couple of responses coming in from the mentee. Sana, your arm is still up. Is that an old arm, or would you like to come in again?
It's an old hand.
Okay. Anyone else? Any additions will be greatly appreciated. Yes, Rania.
Yes, actually, as for Jazur from Palestine, West Bank, and Gaza, as I have mentioned earlier, we have to adapt to what is happening. We have shifted our work to be a direct service provided in collaboration with the UNRWA and the Ministry of Health, because in the north of Gaza, in the first couple of months, there were no facilities for the Ministry of Health or the UNRWA functioning. So Juzur, with the support of UNICEF, has had led all the children vaccination in the north of Gaza. And we have also worked with the staff of UNRWA and AMOH to support us in the medical point to provide all the services to the people and the IDPs in the north of Gaza and Gaza City. This was part of our adaptation. And also, as colleagues mentioned, we have used the PAL Pay methods and digitalized methods of paying to people so they can go and get some, let's say, food baskets or what is available at the beginning of the war. Thank you.
Thank you, Rania. And please keep on your comments coming in the chats and also in Menti. The responses here, include adapting funding, diversifying funding, direct implementation. And I think that tells us that, the LNAs, the local actors will always be on the ground, irrespective of the situation. Government engagement is increasing or is available, and also trying to secure funding from individuals, and those individuals are responding.
Martha, I think
Opening new
Hassan
medical
Mohammed
points.
wanted to speak.
Oh, I can see. Yes, Hassan, thank you.
Morning once again.
Morning.
Yeah, from our own part, the government in Nigeria, especially the state government, were engaged and they're willing to do more. Because like we have several meetings with them, they've made a lot of promises, making sure they've provided some funding to the local organizations so that we can continue to do the services. And another thing, the organization was able to engage more individuals who are a lead in the state or in the federation at all, to say that what they can do, and they've responded well. We are now, some of them started responding, and we are waiting for others to continue to respond to the promises they've already made. Thank you very much. This is all from my own side.
Thank you so much. Any additions? I may not see everyone. Please, if I don't pick you, you can unmute. Yes, Haya.
Actually, I don't want to repeat what mentioned by colleague, especially from Rania and Dr. Sana from Palestine. But as UNRWA, as mentioned by Dr. Sana in Gaza, we established a flexible and medical health point to ensure continuous medical care despite the damage in the health facilities and restricted movement also. Also, we, as mentioned by Dr. Sana, we enhance the nutrition intervention following the nutrition cluster activities in updating the guideline. So we adapted these guidelines to our operational within the primary healthcare services in many health points, including at health center facility and shelter facilities as a medical point. Also, regarding the food security, we scaled up the emergency food assistance to include all the population in Gaza, the 2.1 million, in collaboration with partners such as WFP and other partners. Also, we adjusted the food parcel composition to meet the increased nutritional needs and the limited food, let's say, cooking facilities in Gaza. For example, our food parcel now is estimated to cover at least 90% of the nutritional needs, which in reference to sphere index. So it's estimated to cover around 2,000 calories per day per person. In other fields, such as West Bank, we also have limitation, as mentioned earlier. For example, we have 3 health centers that remain closed in the northern area, to mention in Jenin, Tulkaram, and Nur Shams area. So what we, let's say, how to accommodate this, we, let's say, developed health points to address the needs. Also, we have strengthened the collaboration and coordination with the Ministry of Health and local organizations. Also, we prioritize some services, especially in the West Bank, let's say, in the camps area, because in camps area, the only provided, UNRWA is the only provider for the service in that area. In other fields, if I want to mention Syria, Lebanon, and Jordan, we can say in general, We continue to strengthen our partnership with multiple organizations, including UN agencies, local organizations, international organizations, and the ministries. Also, we are working to strengthen the local capacity building depends on needs. And for example, in Lebanon, we need the nutrition in emergency, and we need let's say, the awareness about multiple micronutrient supplementation. For example, يعني it depends on the context of the field. يعني this is in general in continuation what mentioned by Dr. Sana. Thank you.
Thank you so much. Any additions? I think we'll continue. Thank you so much for sharing. We'll continue. Next slide.
Thanks, Martha, for taking us through that last poll. So colleagues, we are coming to the end of the session. I wish we had more time. I wish we could hear more. There is one more time for the session later today, if anyone would like to join that. But just in general, I wanted to say that on behalf of the GNC Anti-Racism and Localization Working Group, just really want to thank everyone for their engagement today in this important discussion. Thank you for those who shared. Thank you for those who listened. This is a critical moment of change in the humanitarian sector, and we want to make sure that there are spaces for nutrition and emergencies practitioners, but especially local and national actors and their allies to engage in dialogue. That is going to be helpful for us to both understand the challenges, but also understand what are the opportunities, what are the, how are organizations innovating, how can organizations learn from each other, so that we can also help us to imagine and work towards a better future. So I really appreciate your leadership and insights, those that have shared and those that have spoken up during these conversations. We are noting everything. We are recording. We are, our idea actually is that we want to take these conversations. We want to note what are the challenges, note what are the opportunities, note what you're saying and what you're experiencing. And we actually want to include, compile that into a very brief report that's going to be made available to the GNC Collective as a common good, something that's available to everyone, but is really sort of capturing, your experiences and your insights. I can give an example of how this might be useful, specifically for the Global Nutrition Cluster. This means influencing how we are actioning the GNC Localization Roadmap, which is something that guides us on our localization journey. It's also going to help us envision the future of localization and locally led action in the next version of the GNC strategy. So just to say, I think this is really useful and really helpful, and we're going to be compiling everything from the entire series to be shared. So just thank you so much. As always, if anyone is ever in need of nutrition and emergencies technical support, please submit a request through the GNC website or speak with your in-country nutrition cluster team. Always happy to hear from you.
Thank you, Alexa. Please do join us for the rest of the series. There's a questions of what next. When are we having all these recordings?
Yeah, we will just share materials from each session, colleagues, as soon as we can through the event webpage. There's the web page for the event, and then we'll try really swiftly after the series concludes to compile our findings and from these important conversations. Aya, did you want to? I see your hand is up. Did you want to come in before we close?
But it doesn't have any different because I calculated. I consider it in the.
Okay. If not, with that, we are at, if not a little past the hour. Colleagues, thank you so much. Really have appreciated your time and looking forward to the next session. Thanks.
Thank you.
Thank you.
Thank you. Thank you.
Yeah. Thank you.
Thank you.